ensure efficiency, integrity, and professionalism. We are building a new institution from the ground, and this requires a fresh, competent workforce. And I wish to be categorical. Recruitment into SHA is strictly based on merit, unlike the NHIF, unlike the defunct NHIF. There is no automatic transition. However, Honorable Speaker, we were guided by the courts. The former staff of NHIF went to court, and we were guided by the law and the courts that we must give priority to competent, qualified former NHIF staff. The days of nepotism and incompetency are behind us. Only those who prove their worth will serve the people of Kenya. And Honorable Speaker, to make the record straight, to date we have only recruited 144 staff members, representing 17% of the total approved establishment of 815 positions. The initial phase focused on securing the top leadership and the core leadership and the technical experts needed to operationalize the authority, including the CEO and the directors. We are now doing a massive recruitment drive for 425 senior officers in order we decentralize them to our counties. And this exercise has been highly competitive. We have received 17,434 applications, and we are following vigorous shortlisting process. We have shortlisted 1,737. And Honorable Speaker, I want to categorically say the list that is circulating in the social media is a fake list, is not from SHA. And I am ready to present the truth. Yeah, there are people who doctored that list in terms of counties, in terms of tribes, for their own reasons. I have a full report before Parliament, and I'm ready to submit that. That list is fake. That list is meant the people who could not say anything about SHA. They have looked for anything under the sun, and they have generated a fake list. And I am ready to appear before the committee of even cohesion and integration. I think that committee still exists in the House. Yeah, I'm ready to appear before that committee and put everything on the table. But that thing which is going round is not from us. Honorable Speaker, let me go to the pillar number 2, comprehensive healthcare information digital superhighway. This superhighway has been the game changer in our history, where for the first time visibility of our healthcare sector, all our 47 governors, the whole leadership of MOH, the president himself has a digital dashboard that he can follow what is going on in the health sector. And Honorable Speaker, if you allow us, we can give Parliament also a dashboard that can be put somewhere. You can see even the bed occupancy of Kenyatta Hospital. We have successfully, up to today, digitized and linked 10,277 transacting faith-based and private hospitals into one digital superhighway. We have specifically have 4,149 public facilities that are now fully digitized, because slowly we are training and we are digitizing them as we move along. And to support the Taifa Care system, we have delivered 30,087 digital devices, including the biometrics. And that's why you see, Honorable Speaker, under SHA, there's no card. Honorable Speaker, under SHA, there's no card. It is your thumb. Particularly now we have finished level 5, and digital devices I'm talking about across the country. And this is to ensure that the most remote dispensary can transact data in real time. Honorable Speaker and members, this digitization is not just about efficiency, it's about the potent weapon against corruption. The era of manual claims, opaque processes allowed theft to thrive. And that's why you see in today's headline, the 11 billion shilling lost between October when Shah kicked off to April when I took over, the system did audit. And we found facilities were stealing because they were used to stealing from NHIF. And how do they steal? So that 11 billion is rejection. We have presented. So that 11 billion is rejection. We have presented to the committee. And I will give you what are rejections. There are facilities in our country that have reported 100% of the mothers who came to deliver have gone through C-section. That is even against the WHO rule. The WHO rule, international accepted, is 10 to 15% of mothers who go to deliver in hospital will go through C-section. And I think the member for the vice chair of Health Committee, Honorable Pato, is here. When I went to Tharaka Nithi, one private hospital said 500 mothers came here, all of them delivered through C-section. If that happens, it's against the law. The former chair of Health Committee, Honorable Sabina, is looking at me. Shah will not pay. Secondly, we have hospitals who are saying they want to be paid for maternity, and they are not providing two very important documents. The first document is the claim form. Claim form is in the law that you have passed. And even you, when you go to your doctor, a claim form, a legal document, is filled by 3 people. The patient must fill. You have seen your doctor or your nurse after they take the normal thing they tell you fill. Then the doctor fills. Then the hospital administrator fills. A situation where we find, Shah finds that claim forms are filled by one person, one handwriting, one pen. That is a rejection, and we will not pay. It's part of the 11 billion. Thirdly, there are people who are submitting that maternity delivery has taken place in a facility. And any healthcare worker listening to me will know that when a baby is born in a facility, and there are doctors in this August house, there must be a very important document called birth notification. If you submit claim forms for maternity and there's no birth notification, how are we sure that a child was born? That is a rejection. We will not pay. It's part of the 11 billion that you saw today the nation has carried. Finally, the last one is when people make claims on surgery procedures that somebody has gone through the theater. There's something called theater notes. And you have seen, as the person is being taken to the theater, there is a file on top of the patient. That file carries the theater notes. So if you don't submit the theater notes to be part and parcel of your claims documents, how will Shah be sure to pay that claim and that procedure and surgery has taken place? I will tell you of something, even PhD, the primary health care facility, which is free outpatient. Now, you know, the system picks patterns. It's not human beings. These days, there are no claim forms. You know, under NHIF, the claim and everything was done at the counties, by manual, by people. And they sit together. Now the system picks patterns. And this morning we have picked a pattern. Let me just add it. In fact, half of my team don't know. In primary health care, in one of our counties, we have picked, there's a patient who's accessing one of our dispensary or our health centers in that county, in that facility, 10 times a day. Yes. The how is a rejection. The how is a fraud. The how is the 11 billion that we have. We have just picked it. And we have said it, we will have a conversation with the governor of that county. Because he wants to get more capitation, so it creates, the facility creates ghost patients, and they go in the morning, they come lunchtime, they come, but they don't know that the system picks. We have one patient whose dependents' children were 381 in Kwale County. In Kwale County. And we are giving such patients, we are giving them to the DCI, and we want to, the DCI will ask, can you show us your 371 children? Because the system is speaking. It's not human beings. This system looks for patterns. It will even tell you how many surgeries have you done. Yeah, for dialysis, most Kenyans who go through dialysis, there are two, fully paid by SHA. There are some who go the third one, which they have to pay. If we see this patient going for 10 times dialysis, then that's not a dialysis patient. So the system has really helped us. This system, Honorable Speaker, has what we call AI-driven fraud engine. It's very active. It detects anomalies in real time. For instance, the system flagged the facilities claiming for procedures that they lack equipment to perform. We found one facility in a county where they told us level 3, they said they are doing C-section. So I walked into that facility and I asked, the governor said that facility cannot do C-section because there's no theater. So I told him, let's go to it. And when I went and we found the gentleman running the place, the first question I asked him is, take me to the theater, and he says, I have no theater.